गांव और शहर की दूरियों को काटते चले। ज्ञान को प्रचार दे प्रसार दे, ज्ञान को प्रचार दे प्रसार दे, स्वयं सजीव सुंदरा सवार दे, स्वयं सजीव सुंदरा सवार दे। और नारियां रहे सदा, बड़े बड़े बनों की शान ओढ़ती रहे धरा। तरक्कियों की एक नई कतार दे, तरक्कियों की एक नई कतार दे, स्वयं सजीव सुंदरा सवार दे, स्वयं सजीव सुंदरा सवार दे।
सुमन सर,
ये जाति धर्म बोलियां बने न शूल
শুনছি।
সুমন স্যার শোনা যাচ্ছে?
হ্যাঁ যাচ্ছে যাচ্ছে। আমার ভয়েস আসছে তো?
এবারে স্টার্ট করে দাও।
হ্যাঁ স্যার, এটা টোটালি শুনছি।
হ্যাঁ স্টার্ট করে দাও।
অনন্ত স্যার শোনা যাচ্ছে?
অলরেডি আওয়ার স্পিকার, হ্যাঁ স্পিকার এন্ড গেস্ট অলরেডি, হ্যাঁ স্টার্ट।
उठे समाज के लिए उठे उठे, जगे स्वराष्ट्र के लिए जगे जगे, स्वयं सजीव सुंदरा सवार दे, स्वयं सजीव सुंदरा सवार दे।
স্টার্ট করে দেবে।
सजीव सुंदरा सवार दे, स्वयं सजीव सुंदरा सवार दे, स्वयं सजीव सुंदरा सवार दे, स्वयं सजीव सुंदरा सवार दे।
সুমন স্যার শোনা যাচ্ছে? হ্যালো হ্যালো,
শোনা যাচ্ছে শোনা যাচ্ছে শোনা যাচ্ছে।
Suleiman, please start.
ওকে স্যার।
Yeah, we have already our honorable speaker and guest also. Already start.
Yes sir, yes sir. Good evening to all the respected dignitaries present here, the faculty members, all my dear students, and a very warm welcome to our honorable guest, Dr. Kajal Krishna Bonik. Yes, welcome to you, Doctor. This program, which is initiated under the auspices and the brainchild of our principal, Dr. Shubhashish Panda, along with the NSS unit of this college, focuses on mucormycosis, the black fungus infection, maiming COVID-19 patients in India. Okay, as we all know that mucormycosis is the recent deadly infection which has gripped the recovered patients of COVID-19. Even as a deadly second wave of COVID-19 ravages India, doctors are now reporting a fresh new cases each day about this black fungus infection. And India, this goes as per the report of the BBC, which says that India has reported more than 8,800 cases of deadly black fungus in a growing epidemic of the disease. The normally rare infection called mucormycosis has a mortality rate of 50%, with some only saved by removing an eye. But in recent months, India saw thousands of cases affecting recovered and recovering COVID-19 patients. Doctors said there is a link with the steroids used to treat COVID and diabetics. The diabetics are a particular risk. It affects the sinus, the brain, the lungs, and can be life-threatening as well. So we have amongst us today Dr. Kajal Krishna Bonik, who is a renowned epidemiologist, who will specially talk about this deadly fungal infection, its symptoms, the way of prevention, and the different aspects of the disease. So without further delay, I would initiate the program. First, we have the welcome address by our honorable principal, sir, Dr. Shubhashish Panda. He will give us his welcome address. Over to you, sir.
Yeah, thank you, Sunayan. Yeah. So, good evening to everybody. On behalf of Government General Degree College, Chapra, affiliate to University of Kolani. It is a new college actually, new government college. So, I welcome our honorable speaker, Dr. Kajal Krishna Bonik. Yeah, Dr. Sir. MBBS, DPH, MAE, Public Health Specialist and Epidemiologist for its presentation about mucormycosis and the so-called black fungus infection. So everybody has actually query why it is black fungus. So its history, causes, prevention, etc. He will interact with you during interactive session just after his talk. I also welcome our honorable chief guest, Professor Dr. Subir Dasgupta, Head Department of Zoology, Postgraduate Department of Zoology, Maulana Azad College. He is by also direct teacher at UG level. He is also here. And I welcome our honorable special guest of today's webinar, Professor S.K. Tripathi, Professor of Forestry, Mizoram Central University. He is actually leading plant ecologist. Did PhD from Benares Hindu University under eminent ecologist J.S. Singh, sir. And Professor Tripathi sir also welcome here and already attended. I welcome all dignitaries, my seniors, colleagues, juniors, students, research scholars, faculty members from other colleges and universities, and also other participants. I also welcome local people who joined today's webinar through YouTube streaming. Finally, I welcome all teaching, non-teaching and students of our Government General Degree College Chapra for their support and help, especially NSS unit. Without their help, it was not possible. So with this note, I should stop here, hoping the webinar will be successful to all. Thank you.
Thank you very much, sir, for your welcome address and your words of inspiration. You have always guided us towards new achievements. Now, I would invite Dr. Pankaj Bishwas, who is the Assistant Professor of Bengali in this institution and also the NSS Program Officer, to kindly initiate this program with his encouraging words.
Thank you, Shunayan. Good evening to everyone present here. Respected faculty members from different colleges, respected principal sir, our honorable guest Dr. Kajal Krishna Bonik, and my fellow students. I am Pankaj Bishwas, convener NSS unit GGDC Chapra. Government General Degree College Chapra is a proud owner of an active and large NSS unit. Each year, we are being enriched by new members. NSS regularly performs their regular and special activities and submits the report to the authority. In the special camps, volunteers pick up a backward place as adopted village and try to reform it with cordial efforts. They also arrange blood donation camp and thalassemia awareness camp. The unit organizes tree plantation program, cleaning roads and locality, distribution of pens, pencils, exercise books among the children of the adopted village of Shikra. Apart from the above mentioned projects, it is worth mentioning that NSS unit arranges seminar and awareness drive regarding AIDS, disaster management, how to survive from snake bites, life-saving skills, etc. NSS provide all kind of motivation and field for the students to the strength their mental and physical ability. Even we love to adore their courage and sense of self-confidence so much that we send them to adventurous activities. This definitely shows that we are making a difference. Thank you.
Thank you, Dr. Bishwas. Now I would invite our honorable chief guest, Professor Dr. Subir Dasgupta, Professor and Head, Postgraduate Department of Zoology, Maulana Azad College, Kolkata, to deliver his lecture. We are very proud and happy to have you, Dr. Dasgupta, amongst us.
Uh, Very good evening to all of you. First of all, I express my sincere thanks to Dr. Shubhashish Panda, Principal, Government General Degree College, Chapra, who was my former colleague at Maulana Azad College, for inviting me to be present at this very important
Ishan,
and speak a
what is
few lines. I must congratulate the principal, the entire faculty of the Chapra College NSS team for organizing this lecture session with a renowned expert person, Dr. Kajal Krishna Bonik, at this crucial junction. Mucormycosis, the black fungus, is now common to all of us. And after COVID, it creates a lot of panic amongst us, especially COVID-infected person. I have a special interest in this particular lecture as I was also attacked by COVID in the month of November with a comorbidity of diabetes. I hope today's lecture will enlighten many important insights of mucormycosis, which helps to know the detailed pathophysiology of the disease and help us to acquire more knowledge about mucormycosis. I wish all the best of today's program. Thank you.
Thank you, Dr. Das Gupta, for your enlightening words. Now, I would like to invite our honorable special guest by Professor Dr. S.K. Tripathi, as our principals had already introduced him. He is the professor and head, Department of Forestry, Mizoram University. And we are indeed very happy to have a person from Mizoram, such a far away place from here, to have amongst us here. As this webinar has given us the scope of interacting with him through the virtual medium. So over to you, Dr. Tripathi. We are waiting for your lecture.
Thank you, Dr. Pankaj Biswas, for introducing me. I am thankful to Dr. Panda, Principal of Government Degree College, Chapra, for introducing me and for making me the part of this program. The program is very topical. Right now, I think we forget about this kind of disease, which was, introduced, I think, reported long back in 1985 by a German pathologist called Toff. And after that, it was in 1980 and 90, somewhere it was noticed in France. After that, I think the cases were very less. This is the black fungus, zygomycosis. There are many names also. But the fungus, I think, as we remember, it belongs to the order Mucorales and class Zygomyces. And because of that, it is Zygomyces also it is called. So right now, in the post-COVID symptoms, it is highly prevalent in the persons which are having some comorbidity or the diabetes or any other BP or some other chronic problems. It is affecting those patients. So certainly, I'm very happy that we have a very eminent doctor, Dr. K.K. Banik here. So he will be just enlightening us to know about the mucormycosis a little more, because during this time only we have been able to know about this disease, and it is causing a lot of death. So in normally 22 to 50% people, they are getting death, the death, and critical patients, they are just getting more affected, more severely affected. So we have to be very careful. So thank you, Dr. Subhasis Panda, for organizing such a very topical lectures, which can be very helpful for the scientists and even for the general public also, those who are joining. And I can see there are about 97, 98 people, they have already joined. So I'm very happy. I'm thankful to all of you, and I'll join this program. With this word, I would like to stop my speech, and I'd like to continue with another person. I think somebody may like to introduce the program. Thank you. Thank you, all of you.
Thank you, Dr. Tripathi. Now, ladies and gentlemen, the man we are all awaiting to hear from, Dr. Kajal Krishna Bonik. Before introducing him, I would like to give a short, brief bio note about him. We have all heard him in television or in Hotstar or in digital platform medium, but this is a rare opportunity where we can hear him directly speaking to us. Dr. K.K. Bonik was born on 16th May 1961 at a small village in Burdwan, and he had his schooling at a village school before, and then later on he was admitted to NRS Medical College as a student in 1979, and he had completed his MBBS program in 1984. From student life, he was involved in various socio-medical political activities. He had joined West Bengal Health Services in the year 1988. He passed his diploma in public health from All India Institute of Public Health, Kolkata, and stood first in the university exam. He has done his master's in applied epidemiology from National Institute of Epidemiology, Chennai. Apart from this, he had worked in different districts of West Bengal in various capacities under the state government. He was the state secretary of the IMA Bengal for 4 years. He also worked as the All India Joint Secretary of the IMA. He was the editor of the JIMA, the largest medical journal of the world. He was the secretary of the Bengal Obstetrics and Gynecological Society. He is presently working as the editor of the Journal of the Association for Prevention and Control of Rabies in India. And he is looking after the vector-borne diseases control program in the North Bengal districts as well. He has traveled extensively in countries and foreign countries as well, such as USA, Thailand, Japan, Malaysia, Bangladesh, Singapore, Mauritius, and he had presented scientific papers in different national as well as international conferences. He is also involved in Students' Health Home, People's Relief Committee, Cricket Association of Bengal, and various other programs. So the list is endless, ladies and gentlemen, and he will achieve further forthcoming endeavors as well in his future lives. So better to stop here and invite Dr. K.K. Bonik for his very famous for his lecture, which we are all impatiently waiting at this hour. Over to you, Dr. K.K. Bonik.
Hello, good evening. Am I audible, sir?
Yes, sir. Yes, sir. You are audible.
Thank you. Good evening, Mr. Dr. Panda, the principal of Government General Degree College, Chapra, under the Kalyani University. A respected guest, Professor Dr. Shubir Dasgupta and Mr. Tripathi, distinguished members of the faculty in different departments under the college, my dear students, fellow colleagues, ladies and gentlemen. At the outset, I must express my sincere thanks and gratitude to Dr. Panda that he had kept my name in his mind after a long time. When we last interacted, probably at Maulana Azad College, and Professor Dasgupta was also there, I think. So anyway, that's a pleasure for me that after a gap of about 3 to 4 years, we are here to interact on a very important ongoing issue of public health. That's mucormycosis, better known as black fungus. What I have planned today, that I will deliberate my discussion on certain aspects. First of all, ladies and gentlemen, let me clarify that today's mucormycosis is not at all black in color. It's not at all black in color. To be black, we must have melanin in its body somewhere. Actually, black fungus are a different distinguished group of fungus. Dematius hypomycetes is a group wherein in the cell walls of these fungi, there is melanin in it. That's why it is black in color. But unfortunately, these fungus, this black fungus, actual real black fungus, usually kept its invasion at a local area, and it is usually affecting the skin through different injuries. Very rarely it disseminate. On the other hand, the mucormycosis, it's also a group of fungi, popularly known as mainly by the media as the black fungus, as because it mainly affects the zygoma, the bones, the sinuses. That's why the main group is called zygomas. Frankly speaking, friends, it's not a new disease, not a new at all. It was there. But sometimes, due to this pandemic, we have learned some new terminologies in our medical science. And perhaps you will all agree with me, never ever we have heard that lockdown could be a management protocol in managing certain infectious diseases or communicable diseases. But we have learned since 2020 that lockdown could be an avenue to control the communicability of the disease. Similarly, the black fungus or mucormycosis has gained importance during the recent times after this COVID has first wave has subsided. During the heavy second wave from certain pockets of the country, this mucormycosis gained new momentum and brought the attention from medical, administrative, as well as international agencies concerned. At present, at least 10 to 12 state governments has declared this mucormycosis as a notifiable disease. But I like to assure Mr. Dasgupta that it's not common. It's not a common disease at all. It's a very rare disease, but once it really happens, it proves its fatality. It's a fatal disease, no doubt, if remain untreated, uncared for. It's not infectious as such. It's not infectious as such. It's mostly a disease of the poor countries. I was going through the literature and I've seen, astonished to see that around 70% of the global cases of mucormycosis, about 70% of the global cases of mucormycosis are reported from this land, this India, our country. If you ask me why such a large number of cases of mucormycosis are reported from India? Definitely, the agent, the fungi, is very much abundant in our country, in our soil, in our environment. And it's because we are having a large population, 130 crores. So large susceptible population is very much there in our country. And we are very much lacking in our health screening, checkup, and monitoring system. So in our country, 70% of the global cases are being reported. And fortunately, we'll be glad to know the other countries of the Asian subcontinents are reporting cases from China. And from Europe, the maximum cases are reported from Portugal. 34% cases are from Europe, and some middle, only about 2 to 3% cases are reported from Australia, New Zealand, and other areas of that subcontinent. Let me frankly speak that this mucormycosis is a disease, is an infection that may affect any one of us if we do not have sufficient ability to protect us, because this fungi is very much present in our environment, in the soils, in the common items we used to preserve in our households. আমরা যারা বাড়িতে পাউরুটি দেখেছি, দীর্ঘদিন পাউরুটি রেখে দেবেন, দেখবেন কালো কালো কিছু একটা যেন জন্মেছে তাতে। That's the fungus. And this fungus is very much able to remain for a long time if the decaying foods, decaying organic matters like fruits, vegetables, breads, etc. are coming in contact with our body system. that fungi get a chance to entry in our body system. Usually it comes through our inspiration, through our respiratory system, through our noses, through our eyes, or sometimes through our mouth or oral cavity. That's the usual route, but some cases of mucormycosis can gain an access to our body when our skin is injured by some accidents, by some cuts, or some even burn cases. So, considering the methodology or the route of, at route of entry, mucormycosis affects different parts of our body in different times, of which, if you consider the types and forms of mucormycosis, we have rhino-orbital-cerebral. Rhino-orbitocerebral, the most common form. That means the nose, the sinuses, and the brain. Second group of people who have mucormycosis in their lungs, we call it pulmonary mucormycosis. It may affect our GI tract. Our খাদ্যনালী, digestive system is being affected, and this group of people we term as gastrointestinal mucormycosis. When the skin is infected, mostly this is called cutaneous mucormycosis, and sometimes it may disseminate in different parts. That's what group of people mostly dangerous. Fatality rate is high. In that particular group, we call disseminated mucormycosis. So, according to the site of affection and the spread, this mucormycosis happens to whom it affects first. Definitely not even me, those who are having sufficient antibody in our body to protect the infections. It affects only those who are having less amount of immunity because of some diseases, some conditions, some post-treatment conditions. What are these? It has been seen, and one of the major reasons for India to have the highest number of mucormycosis cases is because all of you know, India is said to be the capital of diabetes mellitus. A large number of our countrymen are having diabetes mellitus, and that too, uncontrolled diabetes mellitus. That's the most important issue we have to understand first. Uncontrolled prolonged diabetes mellitus is one of the major reasons for this fungi, or to be very frank enough, any type of fungi to get entry in our body. So we must have a controlled diabetes in our body, controlled blood sugar level. Second, because of some malignancies in different forms, different parts of our body, our systems, if any cancer or other malignancies are there, people may suffer from this sort of infection often. If you have deficient immunity because of some dreadful infections like HIV, even immunodeficiency virus, which is commonly known as HIV/AIDS. If we have certain injuries over our skin, during the injury, this fungi may get an entry in our body. If we have some extensive surgery, that may be inflicted these viruses, these fungi to enter. And in the recent past, which is drawing our attention, the COVID and the post-COVID, long COVID. In COVID, what happens? COVID-19 is nothing new. It's basically coronavirus. We are dealing with this coronavirus since 1960. Different coronaviruses are there, reported from different parts of the country in different times. The name signifies that there are certain pipes which looks like the rays of the sun. That's why it's corona. And the special corona we dealt with in recent past like MERS and SARS, severe acute respiratory syndrome, and the Middle East respiratory syndrome diseases, which we recently came across during the early part of this 2003 and 2012, 13, MERS and SARS. The COVID-19, the name signifies, this is a coronavirus discovered in December 2019 initially from Wuhan province of China. What happens in this? This is also a respiratory virus. And see, this enters through our nose, through our mouth, through our eyes also. This mucormycosis is also a fungi that cause angio-invasive inflammation and edema. When COVID-19 makes your immune system weak, and this fungi creates an entry lying dormant in our body, waiting for the opportunity to invade, to make you further weak. Due to its angio-invasive edema characteristic, that means it will make your blood supply of different parts occluded. Subsequently, the distal part supplied by that particular artery gets necrosed because the artery supply is obliterated, and the distal part becomes necrosed. That's why it becomes a little bit dark, and sometimes it may be a black area. That's why there is a confusion which one actually real black fungus. So this is the pathophysiology of mucormycosis. It affects different parts, mostly the nose. When it is confined to our nose, it is all right. But as soon as get empty to the sinuses, and from the sinuses, it may go up to affect the brain or go down through our respiratory system to go to the lungs or to the digestive system, go to the different parts of the gastrointestinal system, producing pulmonary or GI mucormycosis. That's the routine pathway for this mucormycosis. When you suspect someone to may have mucormycosis, from the history, if somebody is having immunodeficiency state, of which most important diabetes mellitus, both type 1 and type 2, means juvenile diabetes from the birth or from the early childhood, and the adult onset diabetes mellitus, type 2 diabetes mellitus, if it is uncontrolled, you may have, even may not have COVID-19 infection. Dr. Dasgupta sir, you are rest assured, if you are affected or infected with COVID-19, it's not absolutely necessary that you may have this mucormycosis in later. If you maintain your oral hygiene and hygiene in general, then only it is possible to prevent this mucormycosis.
Thank you. Thank you, Dr. Bolik. Thank you. Thank you.
You are rest assured, sir.
Okay,
I know that you are conscious. You are maintaining your blood glucose level at an acceptable limit.
Yes.
So
Thank you.
you are rest assured, sir.
Please continue. Thank you.
Similarly, certain malignancies may occur in different, particularly the younger populations may have malignancies of the hematological system. Amra jake boli blood cancer. Blood cancer can have less immunity in our body. So this group of people are prone to develop mucormycosis. Similarly, COVID-19, the severe cases of COVID-19 and the moderately severe cases, particularly those who are admitted in hospitals, had to be treated with oxygen, either through nasal catheter, through humidified oxygen. Amra to jadar oxygen deya dekhechi. Commonly আমরা দেখি অক্সিজেনের নলটা একটা বোতলে জল আছে, তার মধ্য দিয়ে আসে। এই জলটা বুদবুদ কাটে, আমরা ভাবি যে অক্সিজেন যাচ্ছে। আমার ব্যক্তিগত অভিজ্ঞতা, I have seen when these bubbles are not seen, common people rush to the nurses on duty there in the hospitals. Jammer oxygen. That's it. So this is a type of humidification of oxygen. And for COVID, we have to give much more than what you expect through nasal catheter. Nasal catheter can give you 2 to 3 liters of oxygen per minute. But sometimes in COVID, we have to give 40 to 60 liters of oxygen per minute. And we have face mask, non-breathing mask, high flow nasal cannula, and ventilation. Whatever may be the route of administration of oxygen, either humidified or non-humidified, there is a possibility of this mucormycosis to get a chance to enter in your body. So therapy with oxygen is a major risk factor. So patients of COVID-19 who are treated in hospital setting with oxygen are at higher risk. And the other risk for COVID-19, we have used steroids. Doctors have to use steroids to minimize the inflammatory reactions associated with COVID-19 from the very early stage. Because of uncontrolled, unmonitored, or irrational doses of steroid therapy for a longer duration of time may cause certain abnormality in our body immunity system, and that's why this small fungi may get an entry to our body. So COVID-19 patients, those who are treated at the home or at the safe home without oxygen and steroid, including certain immunomodulator drugs like tocilizumab, remdesivir, they are not prone to get this fungi infection. So only those who are treated aggressively for COVID-19 are at higher risk. Please make sure of it. So these are the group of people, those who are at more risk of mucormycosis, not all. And at the same time, please remember, it's not very common disease till now. So any question up to this? Those who are at risk, any question up to this? Dr. Panda sir.
Yeah.
Any question up to this? From any
is there any
please.
Questions from the participants?
Yeah. Participants can directly ask question.
Those who have participated in this discussion on mucormycosis, is there any questions from their part?
Sir, I have a question.
Please.
Sir, I am Dr. Srikanta Guria from Barasat Government College. I have a query. Yes, I have a query. What is the probability of of the mucormycosis infection in case of child? Because there are many child who have symptoms like COVID-19, but doctor suggested that do not test for COVID-19 RT-PCR for the child, and they are already treated with some common medicine, and after 3 and 4 days or maximum 7 days, the fever and other symptoms gone. So what will be what is the chances of the child that they will be infected by this mucormycosis at this time, and also after the third wave of COVID-19 that will come after June?
Okay, Dr. Guria. Okay, Dr. Guria, I got your question. Let me frankly speak. I like to share with you, Dr. Guria. COVID-19 is not that much prevalent in the younger age group till date. Though some cases of young group of people reported during the second wave. But still now, we can say that that's not that much predominantly in infection of the younger age group. So if the chance of COVID-19 in younger age group is less, so chance of getting mucormycosis is also less. But if the children or younger people having some other diseases, as I mentioned, hematological cancer, kidney diseases, other abnormalities, blood sugar high, uncontrolled, there is a chance of any infections, including the fungus and the mucormycosis. Though chance is very, very less. Okay. So let me
Okay. Thank you, sir. Okay.
show after this predisposing factors and the vulnerable group identification. Please remember those who are having blood sugar or okay, please. Please, Dr. Roy.
How many chances? What is the chances that can be sprayed from the normal refrigerator? That is fridge.
Please repeat the question.
Sir, what is the chances that can be sprayed from the
Mr.
normal
Priyankar,
fridge,
please.
which household fridge?
Chance of getting fungus infection through household refrigerators.
Yes.
You see, no such study or no such literature is available till date with chance of getting fungi infection, particularly out of domestic refrigerators. No such documentary evidence till date. But ordinarily, you can assume that the fungi, if it is there, if we keep the decayed fruits, vegetables, or breads inside the refrigerator, that will definitely multiply. It's better not to use the decaying organic matters kept in refrigerator or come in contact with this for long. Okay, there is no definite proof. Anyway,
okay.
After this,
thank you so much.
After this, at present we may describe the mucormycosis from three angles. Why it has come to gain so much importance during the recent past. Because of COVID-19 infection, as because it weakened immune system, already there is some derangements, dysregulation of the immune system. At the same time, to get an access of this COVID-19, our ciliary functions get lost. So ciliary dysfunctions, immune dysregulation, and thromboembolism, thromboinflammation, which it causes suffering. These three issues of COVID-19 infection gave a path for the mucor or the fungi to get an easy access to human body. Secondly, hyperglycemia, that means uncontrolled blood glucose level. This is also important. And third is corticosteroids. So these three most important issues are very much relevant to discuss mucormycosis. Number one, COVID-19. Number two, hyperglycemia. And number three, use of corticosteroids. So if you have combination of these three, COVID-19 infection, severely ill, treated at the hospital with oxygen, steroid, and immunomodulators like remdesivir, tocilizumab, and other drugs, high-end drugs, chance is more. Similarly, how you present yourself. As I described earlier, there are different types of mucormycosis depending on the site of affection. If it affects our rhino-orbitocerebral region, mostly the symptoms related with our face, our মুখমণ্ডল, like মুখের একদিকটা ব্যথা ফুলে যাওয়া, মুখের একদিকটা ব্যথা ফুলে যাওয়া, আমাদের চোখের নিচে একটা কালো দাগ, চোখ ফুলে যাওয়া, চোখ লাল হয়ে যাওয়া, একটা জিনিসকে দুটো করে দেখা, we call double vision, নাক বন্ধ হয়ে যাওয়া, মনে হচ্ছে সর্দি জমে আছে, ঝাড়তে যাচ্ছেন, দেখছেন কালো কালো কিছু আসছে, রক্ত পড়ছে, হঠাৎ করে লুজেনিং অফ দ্য টিথ, কোনো কারণ নেই, একটা দুটো দাঁত নড়ছে, পড়ে যাচ্ছে। So these are the early symptoms of this rhino-orbitocerebral. Number one, headache. Number two, toothache, pain in the eyes, double vision, blocked nose, congestion in the nose, discharge, black blood discharge through the nose. These are all important symptoms of rhino-orbitocerebral mucormycosis. So if you have all three predisposing factors plus these symptoms, please suspect and consult a doctor either ENT surgeon or an ophthalmologist or a specialist physician. These are very much required. And if you have pulmonary mucormycosis, mainly the fungi is in the lungs. It enters the lung through the respiratory passage from the nose through trachea, bronchi, and bronchioles. So the predominant symptoms will be persistent dry cough. Sometimes you may have cough with expectoration and with blood expectoration. We call hemoptysis. So if you have all the three predisposing factors plus chest pain, respiratory distress, cough, dry cough, expectoration, or blood vomiting, or cough with blood, there is a possibility of pulmonary mucormycosis, though very rare. Pulmonary mucormycosis is usually more common in patients, in people suffering from hematological malignancies. That is not that much common in COVID-19 cases, though both enter the body through the nose. This is the corollary. If you have diarrhea, dysentery, abdominal pain, blood in the stool, after this mucormycosis infection in the GI system, so there could be general GI mucormycosis. As I told you earlier, that it may gain an entry through the cut wound over the skin. And usually, the cutaneous mucormycosis is a localized infection. It doesn't spread so much. So, depending on the situation, site of infection, this mucormycosis produces different symptoms. How will you diagnose? Very interesting. Very interesting. Mucor diagnosis is very difficult because we do not have enough opportunity or scope or facility to routinely go for culture of the materials collected from the different secretions or different regions. The most common method of diagnosis of mucormycosis is through nasal swabbing, through endoscopic nasal collection of materials. It's a very simple procedure. Endoscopic collection of materials from nasopharynx and detection of this fungi through potassium hydroxide when mounts. It will take only 10 to 15 minutes time. It's a very simple procedure. Almost all ordinary laboratory of microbiology can detect this fungi. It's a cost-effective one. Only a microscope is required. Biopsy from different body tissue is the most important confirmatory mainstay of diagnosis of mucormycosis. But for pulmonary and GI mucormycosis, we have to depend on the HRCT and the specific signs, suggestive of COVID-19 as well as for mucormycosis is evident from this radiological sign. Doctors, radiologists, those who are expert in the field of radiodiagnosis, they can easily identify the patches produced by mucormycosis. So, diagnosis of mucormycosis is a difficult one, but possible through repeated uses. Perhaps many of you are aware and might be interested in knowing the status of the state of West Bengal. So far, I collected information that in West Bengal, we have around 24 confirmed cases of mucormycosis from different parts of the state. And we have established 5 regional laboratories for diagnosis of this mucormycosis in some 5 regional centers like North Bengal Medical College, Kolkata Medical College, Bankura Medical College, like this. So the process of identifying, recognizing the fungi for mucormycosis are there in our state. And like other 11 states, West Bengal also declared this mucormycosis as a notifiable disease. That means whoever, wherever, and whenever gets or coming across with any case of mucormycosis, it's our responsibility to inform the health department that I have come across a case or possible suspected case of mucormycosis somewhere during my work or something else. So diagnosis is very difficult but possible, and we are diagnosing it. Now come to the management. This is one disease in which we can easily apply the age-old dictum, prevention is better than cure. Because all these causative organisms, the fungi, are very much present in our environment, and we regularly, because of our day-to-day activities or certain group of people, those who are involved in certain specific job like gardening, cooking, they are vulnerable to get this infection due to their daily work. So those who are involved in dealing with, fertilizers, gardening, soil, they must use gloves during handling these things. They must use long sleeve shirts, long boot. And in the domestic area, it's better to wash frequently the decaying fruits and vegetables. And those who are coming in contact with the dusty environments frequently, they must wear masks if you are there in a dusty environment. So basically, we have to avoid touching our face. That we are advising regularly for COVID-19 as well. And one study I'd like to share with you, ladies and gentlemen, that a study says on an average, we used to touch our face 16 to 20 times per hour. We have to avoid. We must keep our hands clean with soap and water. We must keep our hands clean with soap and water regularly, frequently. And we must not come or deal with or handle any decaying organic matters without gloves as far as practical. So at the same time, so far the disease conditions are concerned, as I told you, diabetes mellitus. So if you have a regular checkup of your blood glucose level, and if you find it is high, you must have control over the blood glucose level regularly. The drugs, injections, insulin, and other things has to be taken regularly without fail. So this is very important for prevention of mucormycosis and any other infections. Similarly, if your blood sugar level is high, that may produce a condition, we call it acidosis. That is also very, very helpful for the mucus to develop. So we must control our blood glucose level. And not only steroids, we don't know what ill drugs are capable enough to reduce our immunity. So my suggestion, my request to you all, ladies and gentlemen, not to take any drugs without doctor's prescription. Without doctor's prescription, we must not take any medicines, whatever it may be. So prevention of mucormycosis by applying, adopting, maintaining the simple rule of cleanliness. And probably, as because they are aware, they are concerned regarding their cleanliness, the Western world are having less cases of mucor or other this sort of infections in their field. It's only the Indians, the poor Indians, having the maximum number of cases of fungal infections. So, far treatment is concerned, this is very interesting, Like in our COVID-19, sometimes you heard the information from different media that people are collecting, hoarding the drugs like starting from hydroxychloroquine, doxycycline, vitamin C, paracetamol, oxygen cylinders, whatnot. But for mucormycosis, the only drug that is able to treat this fungus is in the injection form, amphotericin B or liposomal amphotericin B, especially produced amphotericin B is the only medical therapy available in our country. But as because this sort of medicine is not that much in use for last couple of years, so the companies, those who are producing this drug, are producing very less amount of this amphotericin B. Government of India has taken up the issue with the companies, those who are having the plan for manufacturing of amphotericin B to increase their production, predicting that a large number of cases can come up in our field of public health in the days to come on mucormycosis. The scope of medical therapy is very limited in mucormycosis because most of the patients report late. They used to come late to the health facility. I hope this pandemic, this hue and cry by the media on mucormycosis has given a chance to all of us at least to go for an early intervention if we have any symptoms that may or may not be related with mucor, to go to the health facility for checkup. It's our experience, and the recent past 24 cases reported to our health facilities in different parts, all reported late. And that's why all the medical treatment protocol has failed. So we have to go for extensive surgical interventions. That means that area, the tissue, the region involved, necros, whose blood supply has been occluded by this fungi, has to be removed. It's a large operation, extensive surgery. If it is affecting the eye, only one eye, you have to remove the entire eye along with certain areas of the underneath, under your eye, the sinuses, the teeth, the zygoma, the mandible. It is an extensive surgery. We call it debridement of wounds. It's an extensive surgery, often causes disfigurement. So if it is disfigured, then it is to be repaired by plastic surgery and so on and so forth. So we must not wait for that to come or that to happen. So we must know that mucormycosis is an entity. It is the rarest of the rare disease till date. It is not that much common. It is a 100% preventable disease only by controlling the blood glucose level regularly, by monitoring and taking the medicine prescribed for controlling of blood glucose level, and maintaining of hygienic behavior and hygienic practice. Even if you have COVID-19 infections in the past, not treated with steroids or oxygen, you are rest assured. Only those of COVID-19 warriors, those who are treated with oxygen for a longer duration of time, with steroid for a prolonged duration, and treated in the ICU facilities, they are at risk. You must go for the regular checkup. Don't take any symptom whatsoever minimum is being experienced by you. So likely you must report to your doctor that after COVID, after such and such day, I am started facing or experiencing these symptoms. Please help me and guide me. So with our knowledge, with our information, with our consciousness and awareness in general, we'll be able to tackle this menace of mucormycosis shortly. And I believe with the cooperation of our country people, we'll be able to restrict the spread of this fungi, mucormycosis, at least for this second wave of COVID infection. And we are waiting for the third wave to come. And I believe by this time, the tremendous amount of pressure on the government of India for vaccination to all the eligible population of the country will give a chance to get vaccination. So vaccination, awareness, and using of hygienic COVID-appropriate behavior like maintaining safe physical distance, washing your hands with soap and water or sanitizers, and using proper appropriate mask regularly, frequently, will be able to reduce the chance of COVID-19 as well as a corollary of it, the mucormycosis. I think it's enough for you to know about mucormycosis. And with these words, if you have any question, I request Professor Panda, the principal sir, or any other persons who are having any question, please raise your question. I'll try
Sir, I
my
have a
level
question.
best. Please.
And
Sir, if someone is
One,
affected by
one person at a time, please. One person at a time, please.
স্যার
Mr.
কোশ্চেন আছে আমি বলতে পারি
একজন করে বলুন। মিস্টার মৈত্র বলুন।
বলছি আমি তাহলে
হ্যাঁ বলুন।
হ্যাঁ আমি ডক্টর তপন কুমার মৈত্র এইচওডি বটানি আনন্দমোহন কলেজ অ্যাকচুয়ালি মাইকোলজির স্টুডেন্ট তা আমি দেখেছি যে মিউকোর সাধারণত আমরা যখন ক্যালকাটা ইউনিভার্সিটি ল্যাবে কাজ করতাম তখন দেখেছি অপটিমাম টেম্পারেচার 25 to 30 ডিগ্রি থাকে
রাইট
আর 80 ডিগ্রি হচ্ছে হিউমিডিটি এছাড়া আর কোনো কি ফেভারেবল কন্ডিশনস আছে যেগুলো মিউকোরের পক্ষে এমনি গ্রোথে বা মিউকোরমাইকোসিসের জন্য হেল্প করে এটা যদি কাইন্ডলি একটু বুঝিয়ে বলেন আদারওয়াইজ আপনার লেকচার ভেরি লুসিড ভেরি ইনফরমেটিভ নো ডাউট থ্যাংক ইউ ভেরি মাচ
Sir, I must admit that you know better than me on mycology. But point is, as you know, fungi prefers dark, cool place. So all the conditions having dark, cool place with acceptable humidity of 80% will be a very good environment for the fungi to grow. But so far mucor in human body is concerned, it must get some sort of human tissue to proliferate more and to occlude because of the inflammatory process to occlude the arteries blood supply. That much so far I understand mucor in our mycology subject, sir. I think that's all for you. Next question, please.
Thank you. Most welcome.
Next question. Is any other?
Mr. Rishiraj Majumdar.
Mr. Majumdar, please.
I'm Rishiraj from Ashutosh College, Environmental Science Department. I must say that if someone gets affected by mucormycosis, then should we keep him or her in complete isolation like COVID patients are done?
No, not at all. Mr. Majumdar, you must rest assured that this is not an infectious disease. It doesn't spread from man to man. It doesn't spread from man to man like COVID. So if you have or any person is having mucormycosis somewhere in our body, it has to come to the surface and again it has to enter to other persons through either nose or eyes. So must not isolate the person who is affected. It's very rare, it's not contagious, it's not that much infectious. Anyone, please.
Thank you, sir. Thank you.
Anybody else?
Mr.
Deepshikha.
Thank you, sir. Thank you, sir.
What's your question?
Sir, mucormycosis found more in men people. Is it true, sir? আর যদি এটা সত্যি হয় যদি এটা ট্রুই হয় সেক্ষেত্রে কি এটার সঙ্গে হাইপারগ্লাইসেমিয়ার কোনো রিলেশন আছে?
Deepshikha, you are right. Epidemiology says so our women folk are more involved in our kitchens, handling decaying fruits and vegetables much more than the males. It has been documented worldwide that the males are affected more with this mucormycosis. Even the person who have this mucor after COVID-19 so far in India, around 9,000 cases reported, and a large number, around 64 or 67% are males because of their hyperglycemia. They suffer uncontrolled diabetes more than the females. You are right, your observation is correct. I must congratulate you. Thank you.
স্যার দুটো ক্ষেত্রেই কি হয় মানে ডায়াবেটিস ইনসিপিডাস এবং মেলিটাস দুটো ক্ষেত্রে?
No, madam, diabetes insipidus, the reason is different. Nothing to do with our immune system. It's diabetes mellitus and diabetes mellitus, and that too uncontrolled blood glucose. That is important in any infectious disease, maybe with candida, the common fungal infections in diabetes mellitus, and the mucor is non-exception.
Thank you, sir. Thank you very much.
Any more questions from the participants?
Mr.
Sir, I
Roshan
have a
Sina.
question.
One more question from me. Can you allow me?
Yes, sir. No problem.
What is the difference between black fungus and yellow fungus?
Very
Both
good.
are clear.
I think it is a question from Mr. Tapun Moitro.
Yeah, yeah.
Sir, you are much more knowledgeable than me, and as I tried to mention at the very beginning of my talk,
Regarding severity.
sir, I told in the very first session that though it is called black fungus, it is not black. It is rather because of necrosis, the area gets blackened or darkened. The black fungus is something else. It's basically a different group of fungi. I started my talk with this, and that's the Dematiceous hypomycetes group of fungi that produces melanin on their cell walls. That's why they are black in color. And the black fungi, the real black fungi, produce only localized infections. They doesn't disseminate too much. On the contrary, this mucormycosis, which has a capacity to disseminate and invade different parts of our body altogether.
Yellow fungus?
And yellow fungus cases, not that much, but one or two cases reported from different parts. And that's because it's not that much. You see, what as a public health person, I believe we must not discuss the issues which is not affecting the majority. It's useless to go for and বাংলায় বলে না খুঁচিয়ে ঘা করে না, আমরা সেই জন্য ইয়েলো ফাঙ্গাসটাকে আর ঠিক খুঁচিয়ে ঘা করতে রাজি নেই।
গুজরাটে রিপোর্টেড হয়েছে, গুজরাটে
আমি দেখেছি কিন্তু সেই জন্য আমি ওটা নিয়ে খুব একটা, কেননা ট্রিটমেন্ট মোডালিটি অলমোস্ট সেম।
আচ্ছা, আর সিভিয়ারিটির দিক দিয়ে
ফ্যাটালিটি অনেক কম। মিউকরের সিভিয়ারিটি কেস ফ্যাটালিটি রেট, I forgot to mention, CDC USA, CDC Atlanta reported that if the mucormycosis is not taken care of sincerely, the case fatality rate may be around 50 to 60%. Almost half of the cases infected with mucor will die automatically. In our country, so far the data available with Indian Council of Medical Research, that the case fatality rate is around 34%. So it's a dangerous one if it really occurs. But because of lack of proper infrastructure for proper diagnosis, some cases of mucor are missed and some cases are overdiagnosed as well in our country.
Thank you, sir.
Professor Sunan Mukherjee.
আমি একটা জাস্ট প্রশ্ন করছি
Professor Sunan Mukherjee.
Priyankar Roy, again Priyankar Roy, then Sunan Mukherjee. Now Priyankar Roy.
Priyankar sir.
Hello.
No. Priyankar.
Hello. Sir, what is the difference between mold and fungi?
Very difficult question for me to answer. Professor Dr. Tapun Moitro can answer this. So far I understand, fungi is the entire fungi, the whole, and mold is only a portion of the fungi. Like your spore, usually the refined structure of the fungi is known as mold, and the fungi in totality is the fungi. So far I understood.
All molds are fungi, but all fungi are not mold.
All molds are fungi, but all fungi are not molds. That's the correct.
So sir, Mucormycosis is mold or fungus?
Actually, the mold is of concern to us. Actually, molds get the chance to entry in our body. The fungi as such is not entering in our body. So far I understood from little knowledge on mycology.
Thank you, sir.
It's a mold. That's the important one.
Okay. Thank you, sir.
Thank you.
খাবার থেকে ইনফেকশন হতে পারে ডক্টর, খাবার থেকে ইনফেকশন হতে পারে, any food having the fungus?
Yes sir, I told that a small proportion of cases of mucor do affect our GI system, and all these cases are through our contaminated food. যেটা আমি উদাহরণ দিয়ে বলছিলাম যে আমাদের যে পাউরুটি রেখে দিলে যে কালো কালো গুলো ফাঙ্গাই হয়ে যায়, সেগুলো কিন্তু মিউকর হিসেবে আমাদের জিআই সিস্টেমে কোথাও অল্প হলেও প্রপোর্শন অত্যন্ত কম, 1 to 2% of the cases of GI system.
Okay. Thank you.
Hello, sir. I have a question. Hello.
Yeah, please, Riya, please.
হ্যাঁ স্যার, আচ্ছা স্যার, আমি কিছুদিন আগে আর কি নিউজে শুনছিলাম যে ফার্স্ট অফ অল কোভিড এর সময় আমাদেরকে তো বারবার বলা হচ্ছিল যে আমরা যাতে মানে জিঙ্ক এবং ভিটামিন সি খাই। এখন রিসেন্টলি শুনতে পাচ্ছি যে বলছে যে জিঙ্কটা খাওয়া নাকি অতটা মানে অনেক হার্মফুল ইম্প্যাক্ট।
Very good question. Very good question. I deliberately kept this aside. Zinc, vitamin, and iron. You know, fungi to have a lively and encouraging environment, all these are essential. Zinc and iron, it's proved. For iron, it is proved the level of ferritin, if it is high, then the chance of fungi to grow is more. Similarly with the zinc. That's why recently some of the studies do mention that it's better not to take zinc regularly with COVID management or COVID infected persons as prophylactics or therapeutic doses. It's better to have high. And similarly, vitamin C or any other vitamin, I personally, for all of you, if you don't take it otherwise, as a human being, as a medical doctor, as a worker in the public health field for last 3 decades, I never took any vitamin whatsoever externally through tablets or syrups. I do believe whatever food I used to get from my mummy or from my missus.
So,
please.
Vitamins, we can understand that it's a nutrient and it is a day-to-day requirement for us. But how can a metal, it's a zinc or iron or any other metal particles can aid a growth of fungus?
You see, these are called trace elements, zinc, iron, copper, selenium, and these are all trace elements required for different cells to function properly. That's why it's very much necessary for humans cells to grow, as well as the other organisms like fungi and bacteria, viruses. They also require it, a small amount. The vitamin C is a water soluble vitamin. The requirement is very, very minimum. And usually, আমি যেটা সবাইকেই বলি, বাইরে থেকে ভিটামিন সি 500 ট্যাবলেট কিনে খেতে যে পয়সা লাগবে তার তুলনায় অনেক কম পয়সায় আমরা একটা লেবু কিনে খেতে পারি। আমাদের অনেক বাড়িতে পাতি লেবু, গন্ধরাজ লেবু, নানা রকম নামে লেবু পাওয়া যায়। আমরা যদি একটা লেবু প্রত্যেক দিন খাই, খেতেও ভালো লাগে এবং ভিটামিন সি ও সাফিসিয়েন্ট কোয়ান্টিটিতে পাওয়া যেতে পারে। So I never recommend vitamin C as such.
Thank you.
I have.
Dr. Naik, please.
Yeah. Myself, Dr. Amitav Naik from TTB College. I have a question that is rhizophysis also growing with mucor in the human body?
Mucor itself is a rhizopus. There are different names. Initially, many of us, what is today mucormycosis, usually many of us till date, our senior teachers, the aged ones, they call these as rhizo. Rhizopus was the initial name. Subsequently, the names are changing and the things remain the same. Only the names have changed. I think,
thank you, sir.
I think Dr. Panda.
Yeah, sir.
Principal, sir.
Priyankar, do you have any question? Priyankar Roy.
No, sir.
Okay.
I have already asked that one. But
Then
sir,
Sunavan.
one more question. Do we need to aware people for this fungus? For
Of
this black
course.
fungus?
Mr. Priyankar, please accept that why I have been interested to take part in this webinar. When Dr. Panda approached me, I immediately accepted the invitation because I want to get people like you, the teacher, the most sensible portion of our society, to be involved in our crisis hours. The public health of the country, the health of the country are at stake. People like you have to come forward to make your students And through your students, the families have to be aware, and they have to be prepared to maintain the healthy COVID appropriate behavior. At least you can do one job, sir. You just make your students aware that please go for your parents' health checkup once in a year. If they are aged, once in 6 months. That will give you a mileage in the long run. I request you, and through you, all the teachers, faculty members, and respected participants of this webinar, please, after this session, go for your own blood profile tomorrow. Please, with folded hands, I request you all, please go for your health profile tomorrow. I believe many of you are above 35, particularly our lady teachers, the lady participants. Please go for your own whole body checkup, if possible, by tomorrow. At least
Sir,
blood glucose level.
স্যার আমার একটা কোশ্চেন আছে স্যার
Please.
হোল বডি চেকআপ বলতে স্যার কোন কোনগুলো চেকআপ করলে মোটামুটি আমরা বুঝতে পারবো?
It depends on the age, your circumstances, your profession, your workload. আমরা তো সবটা দেখতে পাই না, সব মানুষের একই রকম প্রোফাইল হয় না। যিনি কলেজে পড়ান মধ্যবয়সী, তার সঙ্গে নিশ্চয়ই যিনি রিটায়ার করেছেন, ব্যবসা করতেন, অভিনয় করতেন, তার জীবনযাত্রা এক হবে না। ইট অল ডিপেন্ডস অন দ্য সার্কামস্ট্যান্সেস। অ্যান্ড অফকোর্স আমি আরেকটা কথা না বললে বোধহয় অন্যায় হবে, সেটা হচ্ছে সামটাইমস ইউ হ্যাভ টু কনসিডার ইউর পকেটস অলসো। দ্যাটস অলসো নেসেসারি।
Thank you, sir, for this needy message during this particular time, sir. Yeah. So, Sunoyan Mukherjee,
Yes, sir. I also had a plan to ask him about the over excessive usage of zinc tablets and iron capsules, but someone had already asked Dr. Bonik regarding that, and he has given us explanation. This is a very excellent presentation by Dr. Bonik, and the lucid way he has guided us, that is what is important. And I would just like to end by saying that Dr. Bonik আমাদের এই ভয়টাকে দূর করে দিয়েছেন, যে মিডিয়া এবং চারপাশের যে একটা প্রচার, যে ব্ল্যাক ফাঙ্গাস এই সেই, মানে এই ভয়টা উনি ডিসপেল করে দিয়েছেন।
প্লাস ভিটামিন সি সব প্রতিদিন খেতে হবে, যে রেগুলার ভয়টা, এইটা একটা দারুণ মেসেজ দিলেন আমাদের। হ্যাঁ,
এর জন্য আপনাকে অসংখ্য ধন্যবাদ ডক্টর বণিক, এই ভয়ের বাতাবরণ থেকে আমাদেরকে একটু মুক্তি দিয়েছেন।
এবং যেটা খুব আমি সুভাষিস দা,
there is a question from Shonampi Don.
Just one word. সুভাষিস দা, মানে আই এম রিয়েলি থ্যাঙ্কফুল টু ডক্টর বণিক, যে উনি যেটা বললেন যে ভিটামিন, আমি সেটা সবাইকে অ্যাপ্রোচ করবো, যে ভিটামিন সি কিনে খাওয়ার থেকে টিউবিল ট্যাবলেট, তার থেকে যেটা বললেন যে মানে ফ্রুট ফল আমরা যেটা বাজারে পাই, সেটা যদি আমরা এভরিডে আমাদের মিলে যে কোনো সময় রাখতে পারি, আই থিঙ্ক এটা খুব ভালো হবে। আমি কোশ্চেন যেটা ছিল ডক্টর বণিকের কাছে, যে মাই ফাদার ইজ 78 and my mother is 68, having COPD. So how can I take care of them from this situation?
মানুষ বড় কাঁদছে, তুমি মানুষ হয়ে মানুষের পাশে দাঁড়াও। আমি আপনাকে হাত জোর করে একটা কথাই বলবো, আপনার বাবা মার বয়স হয়েছে, তাদের পাশে ছেড়ে যাবেন না। আজকাল হচ্ছে না, সব বৃদ্ধাশ্রম গুলোতে গিয়ে দেখি সব বাবা মারা হাপিত্তেশ করে বসে থাকে, কখন তার বিদেশ প্রবাসী ছেলে বা মেয়ে একটা টেলিফোন কল করবে। টেলিফোন খারাপ বলে এই তো গল্পে আমরা শুনি না, আমি বাস্তবে দেখেছি ভাই, বৃদ্ধাশ্রমে গিয়ে বলছে বাবা টেলিফোনটা খারাপ হয়ে গেছে, কারণ আমার ছেলের ফোন আসছে। দেখা গেল টেলিফোন সব ঠিক আছে, ছেলে কিন্তু বাবা মাকে ফোন করছে। আপনি বাবা মার সঙ্গে আছেন, আপনি ভাগ্যবান, সেটাই থাকুন ভাই।
থ্যাংক ইউ ডেফিনেটলি, আই এম লাকি, আই এম রিয়েলি লাকি।
ওই একটা কথা বলে না, যার মা আছে সে কখনো গরিব হতে পারে না।
Right, sir. Sonampi.
Yeah. Ask. I think that should be the last question, sir.
Yeah.
So actually,
let us start and end with the ladies' question.
Yeah, right.
But can the person who got any kind of transplantation of organ are prone to this disease?
Oh, thank you, madam. I forgot to mention this. I must congratulate you for reminding me. Yes, any sort of transplant is a risk factor for any sort of infections, because almost all the transplanted persons have to take some medicine, because the organ that has been transplanted to him or her requires to stay and that's why we give some medicine. And all these medicines are prone to reduce our immunity. So these are a group of people I forgot to mention. Yes, I thank you, Ms. Dam.
Now he just BSc student, Maulana Azad College. Yeah.
Oh, my dear student, that's good.
BSc student only,
Actually,
BSc
Ami
student,
Jena Chai, Mr. Dr. Panda, I always learn from the youngsters, you know.
Right.
And they are the pathfinders. Sonampi, please carry on and keep it up.
Yeah.
Okay.
Are you question জিজ্ঞাসা করবে? Any question from audience?
Hello, sir.
Ria. Yeah.
স্যার আমি বলছিলাম যে আমরা না তখন মানে গত বছরই একই তখন
রিয়া শোনা যাচ্ছে না, রিয়া একটু সাউন্ডটা করো, তুমি শোনা যাচ্ছে না।
আমি বলছিলাম গত বছর আমরা খুব সাইটোকাইন স্ট্রম কথাটা শুনছিলাম যে না যে সমস্ত পেশেন্টদের আর কি খুব সিরিয়াস কন্ডিশন হচ্ছে তাদের ওই ইন্টারফেরন গামা বেড়ে যাচ্ছে সাইটোকাইন স্ট্রম। তাহলে স্যার যেটা যাদের ধরুন নর্মালাইজ মানে অল্পতেই আর কি কোভিডটা ঠিক হয়ে যাচ্ছে তাদের সাথে তো মডারেট বা সিভিয়ার যাদের হচ্ছে ব্রিদিং প্রবলেম সেটা তো একটু ডেভিয়েশন আছে, তাহলে কি মানে যাদের ধরুন সাইটোকাইন স্ট্রম হয়েছে তাদের কি ব্ল্যাক ফাঙ্গাসে অ্যাফেক্টেড হওয়ার সম্ভাবনা মাছ মোর এরকম কি কিছু ব্যাপার আছে?
Yes, madam, you are right. Cytokine storm is the basic pathophysiology of the complications of this COVID-19. It's not the virus that causes harm. It's the cytokine storm that's the issue you have to tackle. And to tackle the cytokine storm, we have to use either oxygen, steroids, and the immunomodulators. And these are the group of drugs that if we use uncontrolled, unmonitored for a longer duration of time, that gives you a chance, an environment for the fungi to grow. So their chance is much more.
আচ্ছা হ্যাঁ স্যার, এখানে আরেকটা ছোট্ট বিষয় আমার একটু জানার আছে। তো সাইটোকাইন স্টর্মটা যখন হচ্ছে তখন সামহাও আমাদের ইমিউন সিস্টেম আমাদের লিভারকে কোনো একটা সিগন্যাল দিচ্ছে একটা প্রোটিন তৈরি করার জন্য, সেই প্রোটিনটা আবার মানে ব্লাডটাকে ক্লট করে দিচ্ছে, যে কারণে আবার ডক্টর প্রেসক্রাইব করছে অ্যান্টিকোয়াগুলেন্ট কোনো আর কি ইনজেকশন। তো এটা কি ওই কারণেই যাতে মানে কোনোভাবে স্ট্রোক না হয়ে যায়?
সাইটোকাইন স্টর্মে ব্লাড কোয়াগুলেশন যেহেতু ওর সিস্টেমটা পুরো ডিসরেগুলেশন হয়ে যায়, অনেক ক্ষেত্রেই ব্লাড কোয়াগুলেশন হয়ে যায় মানে উইদিন দ্য আর্টারিজ, ভেসেলস এর ভেতরে ব্লাড গুলো ক্লট করে যায়, আমরা বলি থম্বাস। এইটা যখন ডিসলজ হয়ে যাচ্ছে তখনই স্ট্রোক হয়, হার্ট অ্যাটাক হয়। সেইটা যাতে না হয় তার জন্য ব্লাডটাকে লিকুইড রাখার জন্যই, ব্লাড তো অ্যাজ সাচ লিকুইড, সেটাকে লিকুইড রাখার জন্য আমরা বলি ব্লাড থিনার, মোস্টলি লো মলিকুলার ওয়েট হেপারিন, অ্যাসপিরিন, কোপিডোগ্রিল এই জাতীয় ওষুধ দিয়ে সেইটাকে তরল রাখার চেষ্টা করা। বিকজ ইউ নো সায়েন্স ইজ নাথিং বাট এ কম্বিনেশন অফ কমন সেন্স, প্র্যাকটিক্যাল সেন্স অ্যান্ড সেন্স গ্যাদার থ্রু নলেজ, আই মিন থ্রু লিটারেচার্স।
একজন প্রশ্ন করেছিলেন যে হোয়াট ইজ দ্য ডিফারেন্স বিটুইন রাইজোপাস এন্ড মিউকর। অনলি আমি একটু তার জন্যই বলছি কথাটা, অনলি স্ট্রাকচারাল ডিফারেন্স। মিউকরের স্টোলন নেই, রাইজোপাসের স্টোলন আছে, দ্যাটস অল। আদারওয়াইজ এভরিথিং ইজ অল দ্য সেম।
হ্যাঁ সেটাই স্যার, আমি তো বললামই যে আমরা তো মাইক্রোলজি অত ডিটেলসে পড়ি না, আমরা
ছাত্র সমূহ যারা বন্ধু আছেন তাদের উদ্দেশ্যেই বললাম।
খুব ভালো
ডিসকাশন হলো, খুব ভালো ডিসকাশন হলো।
আমার একটা প্রশ্ন আছে স্যার, আমার একটা প্রশ্ন আছে ডাক্তারবাবুকে। হ্যাঁ ডাক্তারবাবুকে আমার একটা প্রশ্ন আছে। ডাক্তারবাবু তো জনস্বাস্থ্য নিয়ে কাজ করেন। আমার একটা খুব সাদামাটা প্রশ্ন, এই কালোরাত্রির শেষ কবে হবে কি মনে হচ্ছে আপনার?
আপনি যেমন বললেন কালোরাত্রি, আমি বললেন আসিবে ফাল্গুন পুন, তখন দেখিবে। আমরা সবাই সেই রাতে শেষে ওই রাত্রি সব তারারা আছে দিনের আলোর গভীরে।
না আমরা ভাবছিলাম যে এই একটা মহামারী, তারপরে শুনলাম এই মহামারীর আবার একটা দুটো তিনটে।
অরুণাভ, আমি একটা কথা বলেই শেষ করি যে রাতে সব তারারা আছে দিনের আলোর গভীরে যেমন সত্য, তেমনি একদিন স্বপ্নের ভোর আসবে। দয়া করে এবার আমার ছুটি দিন।
ঠিক অবশ্যই।
হ্যাঁ, থ্যাংক ইউ ভেরি মাচ।
খুব ভালো লাগে।
I would ask Rudrasekhar Bosu, the Teachers Council Secretary of the college, to end this program with his words.
Yeah.
Rudra,
Thank you, Sunayan.
Yeah.
Thank you, Sunayan. First of all, I would like to convey my sincere thanks to Dr. Subhashish Panda, the principal of Government General Degree College, Chapra. The one-day webinar on mucormycosis, the black fungus infection maiming COVID-19 patients in India, is really the brainchild of Principal Sir. In this present scenario, this webinar seems to be very much relevant as the number of cases are increasing in our country for last few days. I must thank Dr. Pankaj Bishwas, Assistant Professor of Bengali and the Program Officer of the NSS unit of our college. This event has been organized in collaboration under the wings of Red Ribbon Club of NSS. I must thank Professor Dr. Shubir Dasgupta, Professor and Head, Postgraduate Department of Zoology, Maulana Azad College, Kolkata, to be the chief guest of our program. We are honored indeed to have Professor Dr. S.K. Tripathi, Professor and Head, Department of Forestry, Mizoram University, as the honorable special guest in our event. Our sincere thanks to Dr. Kajol Krishna Bonik, the honorable speaker in this webinar. We have been waiting eagerly to hear from him. Really, listening to him, indeed a matter of pleasure. Dr. Bonik has enlightened us to know mucormycosis better. All the lectures delivered by Dr. Dasgupta, Dr. Tripathi, and Dr. Bonik were nothing but excellent. I must thank Sri Sunayan Mukherjee, Assistant Professor of English, for his lively engagement throughout the program. My sincere thanks to Sri Aruna Bhusinha, Assistant Professor of History, Coordinator of IQAC of our college, for conducting the interactive session. I must thank Sri Krishna Gopanto, Assistant Professor of Political Science and the organizing secretary of this webinar, for his keen efforts. I must thank all the non-teaching staffs of our college and Bengal Computer Institute to make this webinar happen as successful. Last but not the least, my sincere thanks to all the participants who indulged themselves in hour-long discussion. Dear colleagues, research scholars, students, and all other participants, your presence and active participation is always encouraging to us. Lastly, one thing I should mention, that we are going to organize a national level webinar on climate change and its impact upon us on 5th June. We are looking forward to have your active participation there. Thank you all. Thank you very much.
আচ্ছা, আরেকটা কথা জিজ্ঞেস করব।
বলুন বলুন।
হ্যাঁ, বলছি ওই সার্টিফিকেটের লিংকটা কিভাবে পাবো?
আচ্ছা স্যার, আপনাকে আমি একটা লিংক পাঠিয়ে দেবো, ওইটা ফিল আপ করে দিলেই হয়ে যাবে।
স্যার ওই লিংকটা আপনার মেলে যাবে, হ্যাঁ সার্টিফিকেট আপনার ইমেলে চলে
হ্যাঁ। আচ্ছা, থ্যাংক ইউ সুভাশিস। ওকে,
ঠিক থ্যাংক ইউ ডাক্তার বাবু।
থ্যাংক ইউ স্যার।
থ্যাংক ইউ ডাক্তার। সবাই ভালো থাকবেন, সুস্থ থাকবেন, সাবধানে থাকবেন। রাখলাম তাহলে।
ঠিক আছে, থ্যাংক ইউ।